I'm sure in any rare diagnosis, this is kind of a big deal. Your child's going to require more medical testing and more medical care than most kids who are normal. We have commercial insurance. I work in the medical field, my husband works in the medical field, but we're just not high up in the medical field. And nowadays with insurance, you get a deductible, and they don't pay on any medical care until your deductible's been met. And in our case, we have a $2,000 deductible per child, per person in the family. So it's kind of like we financially have a hard time just day to day. So to pick and choose which child, okay, we're going to, let this child go get the echo and go see the specialist, and then we're going to have to wait on this child. I think that's sad. I don't want to have to pick and choose. My 6-year-old has had recent issues with his teeth. We took him to a dentist, and the dentist said that he has approximately $2,000 worth of dental work that needs to be done. Well, that in itself was a big surprise. But on top of that, because he's 6, he has anxiety when he goes to the dentist. And we, in order to fix his teeth, have to get an echocardiogram done in order for them to sedate him to get his dental work done. So we're adding on another $2,000 or so dollars. And it's just not feasible right now. So we've had to take that and just decide that we'll take one tooth at a time. If he starts to complain that it hurts, we'll take him in and get it fixed if we can. If we can't, we'll have it pulled because they're baby teeth, and hopefully he can just deal with it until he gets his permanent teeth in. But I have reached out to so many different people, and the Marfan's Foundation is a great resource. I highly recommend them. They do have conferences. I think it's once or twice a year, I'm not sure. And I just barely found out about that. And I think they do some echo screening at the conferences. But for us, where they hold the conference is a far distance. So it almost cost us as much to go to the conference as it would to just pay for them to go see the cardiologist. I've also been told to apply for disability for the kids. This wasn't anything that I really considered up until we got to this point, and I'm in the process of applying for disability, but it's a process, and it can either happen or not happen. And if it doesn't happen, then we have to try to figure out what the next step is. I have been told that it's probably a good idea to get a disability lawyer, because trying to work on disability cases by yourself is very time consuming, and if you do something wrong, you can get it denied, and then you have to wait and reapply again. Maybe, I don't know if there's a time frame that you can reapply, but I'm really, really hoping that this goes through so that we can apply for disability insurance and hopefully get some help through disability insurance instead of commercial insurance. And yeah, that's about what I've learned about it financially. It's always going to be a hardship, I think. Nonprofit hospitals like Shriners Hospital has been amazing. They see my kids every year. They don't give us a bill, and they do x-rays of their bodies. It started out with x-rays of the feet, and they even x-rayed my husband's feet because they were intrigued to see both. And it was awesome, and it's always been great because I feel like it's a huge relief on me financially, and it's also great to know that how it's progressing, to see what it's affecting, because it starts in the feet and then it works into the knees, it works into the hips, and you need to know the severity of what you're looking at as a parent, and of course as the person affected. It's you just don't know how much they're hurting. A lot of the times they probably don't even say how much it hurts, and they're just living with it because that's all they know. They have also been kind enough, like the last time we were there, I asked to speak to a social worker. And I'm always asking to talk to the social workers because they're your best resource to figure out what's out there, what kind of financial help you can get, if there's grants, if there's any kind of money that can help you get these testings done. It hasn't been super successful yet, but I'm going to keep trying. As much as it can be a little bit of a time-consuming process, it's always going to be worth it. So, with Primary Children's, we have reached out to their cardiology unit and social worker, and they have said, bring the child in, get the testing done, and then we can work with you from there. I just personally feel like that's still kind of a stress, because if we aren't able to get the financial help we need, we're still stuck with this bill. But of course, it's still something that we're thinking about doing. But I'm also in the process of working on the disability. Shriners, I don't know how many hospitals are similar to Shriners, but I know that a lot of people donate to Shriners, and they even have these coins of how much so-and-so has donated. When you go in there, you can see all these coins, and you're just so grateful that there's people out there that have the kind of money that they're willing to donate to causes like this, because I'm sure there's so many children out there that are in the same position we are. They just can't financially afford it. And to have a resource like that in orthopedic is amazing. If we could get it in cardiology, it'd be even more amazing, or almost anything you could request, because there's so many different conditions where kids need it. So I'm sure every state might have something a little bit different, but in Utah, that's the only specialty hospital that I've come across that really doesn't expect you to pay for their service.
And it's only for orthopedic cases?
It's only for orthopedic cases, yeah. So they would like to be able to help with the cardiology, and we had a lengthy discussion about it the last time we were in, which was just a couple months ago. And the doctor even went as far as to call a cardiologist, a pediatric cardiologist that she knew. And that's how I got in touch with the social worker in the cardiology department. But like I said, it was just kind of bring the child in, get them tested, and then we'll work with you and see what we can do. So I haven't gone there yet. So.
Yeah.